Dr. Shahab, you used the word tragic when discussing the state of hospitals and healthcare current in the province. And I mean, that is an accurate description. We talk with healthcare workers all the time who are on the verge of tears, discussing the things that they're witnessing, talking about the level of work that they have right now. I mean, it's no secret how challenging things are. Obviously, the weight of getting out of is on the unvaccinated. However, of course, it is a slow process. And it seems to be currently in your hands to implement restrictions not only healthcare workers are begging for on a weekly, if not daily basis, also your own data would suggest is critical. So if 1/3 of school-aged children are in those are what the cases are currently, why are there no restrictions currently or better case tracking or more isolation for kids right now? If 20% of the cases we're seeing are from small gatherings in homes, why are we not implementing gathering restrictions for people who are unvaccinated or just in general for a temporary time until things get under control? I'm just curious, when the data is presented here so clearly, why there aren't specific things coming into play, especially when healthcare workers and a number of parts are desperately asking for these things to come into place.
Yeah, thank you. So I'll maybe address some of these. There was a lot in that question. I think I absolutely would recommend that we all need to be very cautious with indoor private gatherings, small indoor private gatherings. I've already said that people who are fully vaccinated, many of them are making adjustments. And my recommendation is that if you're unvaccinated, you don't go to any gathering till you get fully vaccinated. Should that be part of an order? Certainly, I think that needs to be seriously considered. It's been a long-standing request from northern and far north Saskatchewan, but as an order, then it has also to be enforced. But certainly that would address possibly 20% of transmissions, and especially as if we see that the mask mandate and other measures may stabilize the curve, but it will take a long time to come down. We will not only not have Thanksgiving at this rate, we will likely not have Christmas and New Year at this rate. It will be a fall and winter of misery at the current rate, that we will have high hospitalizations due to preventable illness. So absolutely, those other restrictions will likely have to come if our numbers don't change. But again, in terms of how restrictions are implemented in North America and in Western Europe, Western liberal democracies, ultimately the government decides what legislative tools it imposes on citizens. And there's a comment made about highly developed societies, which we claim to be, but where citizens also not only have rights, but they have responsibilities. In other parts of the world, SIM cards have been canceled till you get a vaccine. There's mandatory tracking apps. As long as you have a phone, you are tracked all the time, and you get pinged if you are a close contact, and then you are tracked to make sure you don't leave your house. So there are tools that many other parts of the world have deployed. We claim that we don't need those tools because we as citizens have not only rights but responsibilities. So I guess it's on both government and citizens of that country and province to demonstrate that. And I'll leave it at that.